My name is Dr.Shivv. Let's discuss Neet PG bits. First bit. A patient presented with hyperkalemia. Which of the following drugs can decrease serum potassium levels? As you know, from the below options, the answer is insulin plus glucose. As you see, hyperkalemia management, the membrane stabilizer, calcium gluconate, shifters are insulin glucose, albuterol, excretors are furosemide, sodium bicarbonate, sodium polystyrene sulfonate, and definitive is a hemodialysis. Next bit, a deep vein thrombosis patient was started on an anticoagulant therapy. Next day, the patient presented with features shown in the diagram below. Likely drug implicated for this adverse effect is, as you know from this diagram, the drug is warfarin. This condition is purple toe syndrome. It is a rarely reported adverse effect of warfarin. In all described cases, the syndrome occurs relatively quicker after initiation of warfarin. Remember mnemonic ACADEMIC, amiodarone, cimetidine, aspirin, dapsone, erythromycin, metronidazole, indomethacin, clofebrates. Next bit is drug of choice for acute opioid poisoning is we all know that is naloxone. Naloxone is a drug of choice for acute opioid poisoning, but it has to be repeated frequently. Next bit, 10-year-old boy presented to the emergency with vomiting. Patient give history of consuming 8 tablets of ferrous sulfate. What is the antidote of iron poisoning? Simple. Antidote of iron poisoning is deferoxamine. Acute iron toxicity. Young children accidentally ingest iron tablets causing necrotizing gastroenteritis, vomiting, abdominal pain, and bloody diarrhea, followed by shock, lethargy, and dyspnea. Treatment: whole bowel irrigation, deferoxamine, supportive treatment. Next bit. A patient presented with acute episode of breathlessness. Chest X-ray shows pulmonary edema. History reveals that the patient has uncontrolled hypertension and is not taking the medicine regularly, which should be the management of this patient. As you know, it is pulmonary edema, hence the management is intravenous nitroglycerin. Intravenous nitroglycerin infusion is one of the mainstay treatments in acute pulmonary edema. What is the following drugs have least pulmonary toxicity? Sulfasalazine from the below drugs. Drug-induced pulmonary toxicity, acute pneumonitis, bleomycin calculates, methotrexate, procarbazine, carmazine, mitomycin, hypersensitive pneumonitis, procarbazine, azathioprine, bleomycin, methotrexate, pulmonary fibrosis, bleomycin, non-cardiogenic pulmonary edema, cyclophosphamide, methotrexate, cytarabine, mitomycin. Drug of choice for acute severe digital toxicity is digibind. Treatment of digital toxicity is stop digoxin administration, potassium digoxin antibody that is digibind, antiarrhythmic that is lidocaine IV, atropine IV, therapeutic dose monitoring of digoxin. Botulinum toxin blocks neuromuscular transmission by which of the following mechanism? Closure of calcium channels at a presynaptic membrane. As you know, botulinum toxin acts by inhibiting the calcium-mediated exocytosis of acetylcholine from the vesicles in the synapse. Acromegaly patient, surgical removal was not complete. What drug to be given now? Octreotide. As you know, in acromegaly, surgery is a first line. Success variable depends on adenoma size. Greater than 10% failure is present. The medical management is somatostatin, analogs, growth hormone, antagonists, dopamine agonists. Radiotherapy is normally combined with a medical therapy may cause hyperpituitarism. The anti-epileptic drug used for treatment of digoxin toxicity is from the below options. It is a phenytoin. Class 1B drugs, lignocaine, also local stick used in ventricular arrhythmias in myocardial infarction patients. IV administration side effects is convulsions, light speeds, etc. Phenytoin also convulsant, anticonvulsant, drug of choice in treatment of digoxin toxicity, side effects, convulsions, light speeds, etc. Thank you. We shall discuss further bits in next coming videos. Thank you. Please like, share, and subscribe. All the best for upcoming NEET PG exams.